And now, please welcome GMHC Board Co-Chair, Michael Harwood.
Thank you, everyone, for being here. We're really touched by the donations we got because really the funds we get in that last contribution are really freely available funds for the agency that go directly to services for our clients, and it's really meaningful to us. And as I mentioned to the auctioneer, a portion of that amount has been matched for our testing center. We have a challenge grant over the next 3 years, and a portion of those funds will be matched to make sure that our testing gets expanded, because as it bears repeating, GMHC has a 90% viral suppression rate for people who get tested at our centers. And as people here in this room know, testing is prevention. If your virus is suppressed, you can't transmit it to other people. And so that's so crucial to get people into our services and the full volume of services we provide. So really, thank you everyone who contributed and keep contributing. We'd also like to thank, there's some people in the room who have been long-term supporters of the agency, as well as people who are new to our charity events, and we appreciate having everyone here. Also, Kelsey mentioned there are a group of our former board members here tonight, and I'd like them to stand up as well. I know some of the ones I've seen. We've got Jody Falco and Don Deo, Matt Morningstar, Ryan Huckrow, people that I've worked with over the years, Joy Thompson. Many people have been really wonderful supporters of the agency and continue to be over the years. So thank you for coming back again tonight. But also everyone in this room deserves the thanks of the agency. People who have been here forever, our volunteers like Leslie Faye Pomerantz, who was here at the beginning, holding hands and wiping the sweaty brows of people who were dying of AIDS at the very beginning, people who didn't need to be there but were touched by what was going on. We have gold sponsor Joy Thompson and Stanley Thompson, as we mentioned earlier, who produced that wonderful documentary, How to Survive a Plague, which reminded people again how important this issue is. We also want to thank our council members who are here, who represent the districts where many of our clients live. Corey Johnson and Richie Torres have joined us here tonight. I want to thank you for continuing to support us in the City Council and elsewhere. And I know that the people in this room wouldn't be here if you didn't believe in GMHC's mission. And it's not just the staff and the executives and the board, but it's your passion, your conviction, your wisdom in supporting GMHC and keeping our doors open to support our clients and people throughout the city. And we know that there's a cure in the future, and it's the generosity of people here and working together with the governor's fight to end the epidemic and the president's national HIV policy to end the epidemic and eventually to find a cure for this, not just treatment and PrEP and the other things, the tools that we have today. And one of the people who's really fighting that battle for us, another former board member who has gone on to direct service and who's really working hard, both on a policy level and really direct services, going into the clubs, going into the bathhouses, going into agencies and not-for-profits around the city, and working for us to really end this epidemic, and is now, after leaving the board and being a good friend of the agency and a good friend of mine, he's now the Assistant Commissioner to the Bureau of HIV/AIDS Prevention and Control in the New York City Department of Health. I want to welcome to the stage Dr. Demetre Daskalakis.
So I have a great honor to actually give the last award of the night. The concept of HIV testing as a tool in both the care and prevention of AIDS really just seems elementary today, but it really wasn't always that way. Louis Bradbury, GMHC 2016 Judith Peabody Humanitarian Award recipient, came to the board of GMHC in 1989, along with what was then a controversial vision: free, confidential HIV testing ought to be available in a stigma-free environment to those who are at risk for HIV. Thank God he argued that. He believed that everyone should know their status for both their physical health and to reduce the transmission of virus. He felt that GMHC should have a testing facility, and together with his board colleagues, Bradbury made it happen. He served as president of the board of GMHC from 1993 until 1997, but his service to the community did not end there. Today, testing is a critical component in our strategy and any strategy to end AIDS. And we have Louis Bradbury to thank for that. Since 1996, GMHC's HIV testing initiatives have reached New Yorkers who are unable or reluctant to access clinics and private medical providers for HIV tests. In addition to the David Geffen Testing Center, GMHC's mobile testing unit brings HIV and AIDS services to individuals who may be unable to travel to access testing, bringing it out to our community. GMHC's testing programs also offer wraparound services for New York's neediest and rapidly, and as you saw with the 90% viral suppression rate, rapidly connects clients with counseling, emergency food, and other support programs because of his ongoing contributions to GMHC. But Bradbury did not stop there. For the last decade, he has served as the president of the Calamus Foundation, which has granted over $20 million to support important initiatives of many LGBT organizations, among which are SAGE, the Ali Forney Center, the LGBT Community Center, the Long Island GLBT Community Center, Freedom to Marry, and the Transgender Legal Defense Fund. He is amazing. He also served on the board of the Empire State Pride Agenda and was its co-chair from 2011 through March 2014. Under his tenure, the Pride Agenda helped secure passage of the Dignity for All Students Act and the Marriage Equality Act. One more time. It is with great honor on behalf of GMHC, its board, staff, and clients, and I'm going to say for every New Yorker who accesses those services, that we present Louis Bradbury with the Judith Peabody Humanitarian Award. Congratulations.
Oh, thank you. Thank you very much. Thank you, Dr. Demetre, for your kind words. Receiving the Judith Peabody Humanitarian Award is very bittersweet for me. Sweet in that receiving the Judy Peabody Award is both humbling and affirming to me. Like many of you here, I knew her and her work at GMHC very well. To me, she was a hero and a role model who was committed to making the world better for people, especially those less privileged than her. Beginning in the late 1980s, she was a volunteer at GMHC, later a board member, and led a workshop for caregivers and a bereavement group for those who lost partners, family members, and partners to AIDS, which was standing room only and endured for over 20 years. She was an iconic activist who quietly and effectively made a difference in the lives of countless people affected by HIV. I can think of no greater honor than receiving this award named for Judy Peabody. I would also like to acknowledge the activism and voice of Mary Fisher, who boldly and forcefully told the world that HIV knew no boundaries and affected us all. Likewise, Duncan Lance Black has also raised his voice and talents in telling us about Harvey Milk and so many other important aspects of the LGBT community history. It is an honor to be here tonight with both of you. Receiving this award also has its bitter side. GMHC was not supposed to be here now today, at least not as an agency fighting AIDS, to give me or anyone else an award. When the Geffen Testing Center opened 20 years ago, we were all very optimistic that a cure and a vaccine were literally a few months or years away. We all believed that GMHC's years were so limited that when we signed a 15-year lease for our new facility in 1996, we were worried whether we could sublet the space when GMHC closed. Things did not go as we hoped, and GMHC is still here today. The last 20 years have been an incredible journey for the LGBT community. The HIV crisis galvanized our community and created many activists to fight literally for our lives and to our right to have equality in our lives. This energy spilled over to every aspect of our community to create and expand so many of the great LGBT organizations here in New York City and across the country. I marvel at the work so many people have done to advance LGBT rights and access to justice. Yet, while great strides in HIV prevention and care have been made, GMHC is still as vital today and necessary as it was more than 30 years ago. Today, its budget is roughly $25 million. It was $25 million in 1996. The more things change, the more they seem to stay the same. Last year at this dinner, Larry Kramer applauded the important and fundamental role that HIV testing occupies in the fight to end AIDS and HIV, and GMHC's active testing program in particular. In fact, the Governor's Committee on HIV stated that the need for universal testing of vulnerable communities is necessary to reach its goal of ending HIV in 5 years. It's a simple plan. Test everyone, and if you test positive, immediately begin effective medical treatment. Or if you test negative, immediately begin a PrEP regimen if you are sexually active. So simple, but so complex. I don't know what the percentage is, but so many of the people in this city that have HIV do not know it. How GMHC is going to reach them, I don't know, but they are going to be the ones who do it. As an aside, if the governor does not include the necessary and promised funding in his budget this year, that goal to end AIDS cannot be achieved to the detriment and shame of us all. Testing has never been more important. The fundamental role of testing in HIV prevention has not always been universally acknowledged by our activists. In 1993, the official policy of GMHC, AMFAR, and most other HIV organizations across the country was that gay men should not be tested. The reason always given was that discrimination was worse than the disease, and even if you did know your status, there was no effective medical treatment. With my usual bluntness, I argued against this policy, declaiming that we should ask our friends and partners who have died which was worse, the discrimination or death. I still wonder when, if ever, ignorance is bliss. I understand the short-term psychological policy benefits of denial, but not ignorance. To be fair, at that time, there was really no medical treatment except for perhaps some antibiotics like Bactrim for some opportunistic infections, but there was a very bleak medical forecast and environment. To be fair, the discrimination also was terrible, and people with HIV often lost or lived in fear of losing their jobs, apartments, and often their families, not to mention the constant specter of death. In fact, William F. Buckley seriously proposed that HIV-positive people have that fact tattooed on their buttocks. I can't remember whether he suggested that the tattoo go on the left or right buttock, because I don't recall if he was the top or bottom. GMH's goal was always not just to serve people living with HIV, but also to prevent others from becoming HIV positive. There's a teleprompter here and I'm ahead of it, so I could roll a little faster. I'll have to get my notes out since they've stopped it. But more importantly, many of us believe that when gay men knew their status, they could make better and safer decisions about their sexual conduct. Oh, good, now we have the subject. In those dark days, there was a pervasive feeling among gay men that HIV infection was inevitable based upon their past or current sexual activity. So what was the point of getting tested, other than to confirm the inevitable? That is why testing could be so important. If a gay man knew he was negative, he might be motivated to make safer choices about sex to avoid infection. Similarly, we observed that men who knew they were positive took responsibility for safer sex so as not to intentionally infect others. Despite this, the official policy did not change until the cocktail drugs came into effect in 1993. Also at that time, most testing was done in doctor's offices or at anonymous public health centers, and confidentiality was still a major issue. Moreover, even with the new drugs, a positive test result was still regarded as a likely death sentence, and results were often delivered impersonally by mail or a telephone call, making a positive result even more traumatic. Because of this, GMHC developed protocols for emotionally and supportive testing for doctors and hospitals, which later were incorporated in state regulations for proper HIV testing protocols. Given this background, it seemed obvious that GMHC created a testing facility. Again, we were criticized that we had lost our focus and that a testing center was beyond our mission and capabilities. That criticism bewildered me, but we persevered to do what was right, not what others thought was always correct. A lesson that should not be forgotten today. The only remaining issue was the funding, but we approached the Geffen Foundation about our vision for the testing center, and almost by return mail, we received notice of the grant of $2.5 million to establish and maintain the David Geffen Testing Center. So on this 20th anniversary of the Testing Center, let us thank and toast David Geffen for sharing our vision that testing was and continues to be the first critical step in eliminating HIV. To David Geffen. And also thank you to the staff and volunteers of GMHC who created and designed the Geffen Testing Center, who continue to operate and maintain it with the highest standards of efficacy and empathy. One of GMHC's greatest strengths and sources of pride for me in GMHC has been that it is not judgmental. It has never had laid blame or guilt on its clients, as so many others did in our society, but rather it has always accepted people for their inherent value, knowing that all people matter. While starting as a refuge for gay men living with HIV, it has embraced all people living with HIV from all communities. Thank you for this award, and thank you for the honor of having been associated with GMHC. Thank you.